Hello. During the next few minutes, we're going to explore various aspects of orthognathic surgery. The purpose of this video is to help you understand a method of treatment that may be right for you. And because no procedure is without possible risk or complication, we'll inform you of the potential risks or complications associated with your treatment. Let's begin by reviewing some questions that many patients ask. Then we'll provide the answers and explain your treatment options. True or false? Improperly aligned teeth are often accompanied by a facial imbalance. Orthognathic treatment uses the combined skills of an oral surgeon and an orthodontist. Is this true or false? True or false? In some cases, braces alone can correct a bite problem. Orthognathic surgery may be performed under local anesthesia. Is this true or false? Is the following statement true or false? A risk associated with this surgery is damage to the sensory nerve in the lower jaw. These questions are related to areas of discussion in this video, including diagnosis, treatments, alternative treatments, and risks. Now, let's explore these areas in more detail.
The term orthognathic is derived from the Greek words orthos, meaning straight, and gnathos, meaning jaws. When jaws and teeth are out of alignment, or if they're too large or small, a corresponding facial imbalance can result. The goal of orthognathic surgery is to bring the jaws and teeth into proper alignment to create better jaw function. Orthognathic treatment requires a close working relationship between two specialists, an oral surgeon plus an orthodontist. The orthodontist straightens and aligns the teeth with braces, and the oral surgeon subsequently repositions the jaws through corrective bone surgery. A patient's suitability for orthognathic surgery is determined through a thorough workup performed by an oral surgeon and an orthodontist. First, the oral surgeon and orthodontist conduct a comprehensive examination and make detailed records of the patient's medical history, bite and jaw movements, and temporomandibular joints. They also take special X-ray films of the patient's skull and face, as well as photographs of the patient's face from various angles. We also take plaster study models to help plan the final bite results. As part of the diagnostic workup, the oral surgeon sometimes utilizes a computer to project possible surgical results. Now, these records indicate whether braces alone can correct bite problems or if orthognathic surgery is a treatment option. When orthognathic surgery is indicated, we then conduct further analysis. This includes study models mounted on a device that mimics the patient's jaw relationships. The oral surgeon performs mock surgery on the models to determine the potential success of the actual surgery. When the orthodontist and the oral surgeon have agreed on a treatment plan, we communicate the information to the patient in careful detail. Patients are encouraged to ask questions and seek additional information so they understand and agree with all aspects of their proposed treatment.
I'd been thinking about doing something about my bite problem for a long time. My oral surgeon and orthodontist explained the benefits and risks associated with the surgery and encouraged me to ask questions, and I had lots of them. Mainly, I wanted to know how long the treatment would take and what kind of results I could expect.
It's important for patients to understand that orthognathic treatment requires a long-term commitment. It is equally important that the patient have realistic expectations about the results. As much as possible, the oral surgeon and orthodontist keep the patient informed about the duration of the treatment and the likely end results. If a patient commits to the proposed treatment, we initiate the orthodontic phase. During these 6 to 15 months, the orthodontist applies braces and positions the teeth for the bite that will result after surgery. Throughout the orthodontic phase of treatment, the patient makes regular visits to the orthodontist. During these checkups, the orthodontist adjusts the braces and monitors the progress of the treatment. To maintain good dental health, The patient will also need to make regular visits to a general dentist for cleaning and checkups. When the time for surgery approaches, we create new study models. We then perform another mock surgery to confirm that the desired results can be achieved through surgery of either the upper or lower jaw or a combination of both. In lower jaw surgery, we separate the bone behind the teeth and we move the tooth-bearing portion either forward or backward to achieve the planned bite. Except in special cases, the oral surgeon makes incisions inside the mouth so no scars appear on the skin. In upper jaw surgery, we may move the jaw forward or backward, as well as shorten or lengthen it vertically, depending on whether too much or too little of the front teeth show beneath the upper lip. Now, in your case, I think we're looking at a fairly straightforward procedure, but we always conduct this type of surgery under general anesthesia. Now, this means that you will not be conscious during the surgery.
So will the surgery have to be done in the hospital?
That's right. This procedure is too complex to be done in the office.
Oh, there must be risks.
Yes, Nancy, and I want to go over the risks with you in some detail. Now, please, stop me whenever you have a question or you need further clarification.
Count on it.
The risks of general anesthesia can include nausea, vomiting, nosebleed, tooth damage, hoarseness, prolonged recovery, and pneumonia. And, as with any general anesthetic, it may be potentially fatal.
So far, we've reviewed the diagnosis, treatment, and alternative treatment of this surgery. No surgical procedure is without risk, so we want to make sure you're also informed about some of the complications. Your oral surgeon will explain these risks to you prior to surgery. If you have questions or need further explanation, always be sure to ask.
Well, first there's the risk of infection. In any surgery, bacteria are always a threat and may cause infection. However, the infections usually respond to antibiotic treatment. In cases of severe infection, prolonged treatment may be necessary.
Are there other complications?
Depending on the difficulty of the surgery, there are a variety of risks. Besides swelling and bruising of the face and jaws, this can include damage to tooth roots, which may later require root canal treatment. Before I continue, do you have any questions?
Yes, I was wondering, will my jaw have to be wired together?
In many cases, we can firmly fix the bones with tiny screws or metal plates, and your jaws may only be held together for a few days. In other procedures, we may need to immobilize your jaws for a number of weeks to facilitate proper healing. In rare cases, this can result in lasting gum and tooth problems. If your jaws are fixed together, you will also be required to go on a liquid diet. A complication associated with surgery in the lower jaw is the possibility of nerve damage. The surgical site is usually very close to the sensory nerve that runs through a canal in the jawbone. Now, sometimes this nerve is injured during lower jaw surgery, leaving patients with a tingling or a numb sensation in their lip, chin, gums, teeth, or tongue. This sensation, which is similar to the effect of Novocaine, can last for days, weeks, or months. In rare cases, the condition is permanent. Surgery in the upper jaw also bears the risk of complication, since the surgical site usually involves the sinus cavity. This may lead to a sinus complication that requires additional treatment, usually with antibiotics. In some cases, the jawbones take a prolonged time to heal. The bones may then join together in the wrong position, requiring corrective surgery. The new bite position may affect the function of the jaw joints, causing discomfort, clicking, and chewing difficulty. Since jaw surgery has the potential for significant bleeding, patients may wish to donate their own blood for later transfusion during surgery. After an adequate period of recuperation, the orthodontist will begin to move the teeth into a refined position to finish the bite as originally planned. After the teeth are in position, the orthodontist removes the patient's braces and inserts a retainer. Approximately 12 months after surgery, facial tissues will have adapted to new underlying tooth and bone positions, and final results can be anticipated. It is of utmost importance for patients to tell their doctor what they expect before undergoing surgery, so that the oral surgeon can provide a realistic picture of the final results. I want you to read this, make sure you understand. Informing patients of the risks associated with surgery allows them to make decisions about their treatment and have realistic expectations about the results.
Before we close, let's take a few moments to review the questions posed earlier. It's true that improperly aligned teeth are often accompanied by a facial imbalance. In some cases, this condition can be corrected through orthognathic surgery. Orthognathic treatment uses the combined skills of an oral surgeon and an orthodontist. In some cases, braces alone can correct a bite problem, making orthognathic surgery unnecessary. Due to its complexity, orthognathic surgery cannot be performed under local anesthesia. General anesthesia is always required. A risk associated with the surgery is damage to the sensory nerve in the lower jaw. Please consult with your oral surgeon if you'd like further explanation on any of the information in this video, or if you have questions about topics that may not have been included. During the informed consent process, you'll be asked to read and sign a surgical consent form for the procedure just described. Your oral surgeon is committed to not only caring for your physical needs, but also providing all the information you need to make an informed decision about your course of treatment.